People across the country agree that we need to do something about health care. The challenge is how to improve health care for all Americans without losing our high quality of care. 85% of Americans have health insurance. In a recent ABC News poll, 83% said they're happy with their coverage and quality of care, but a majority are concerned about high costs and the number of uninsured. Americans are open to change as long as it doesn't limit their choice of doctors or ration their medical care like the single-payer systems in Britain and Canada.
Well, I'm a Canadian cardiothoracic surgeon. I left there in 1992 because I got sick and tired of the system. There, the bureaucrats make the decision about health care and who gets taken care of and when. And I can tell you quite honestly, I would hate to see that system come down here to the United States.
But some experts fear that 1,000-plus page proposals in Congress will eventually lead to a single-payer system.
I happen to be a proponent of a single-payer universal health care plan. But as all of you know, we may not get that immediately.
One of the major goals is to reduce the number of uninsured people. So let's take a look at who is uninsured in America. Fully 1/3 of the uninsured qualify for Medicare, Medicaid, or veterans benefits, but have not enrolled. Nearly 18 million live in households earning more than $50,000 a year and can afford private insurance. Millions more are healthy young adults who simply choose to go without coverage. The chronically uninsured in the U.S. represent less than 5% of our population. That means that about 95% already have health coverage or access to it. For those people, and millions more who are struggling to afford coverage, there are simple, risk-free solutions, including buying insurance tax-free and allowing people to shop across state lines to get more affordable coverage.
You wouldn't sign a blank contract, nor would you sign a consent, a surgical consent, that has no operation without a discussion of the planned procedure, without a discussion of the outcome, and with some thought of how is it going to be paid for. The American people should look at Congress for those types of answers as well. How is this going to be paid for? Are our children going to be paying for it? We also need to know that we'll be able to take control of our decisions. That as a patient and a physician, you'll be in charge of who is making the decisions about your health care.
Your health is on the line. Learn more. Get involved. Speak up.